Welcome. I'm here with Bram Pasalakwa, the director of Breathing Deeply Yoga Therapy. And today we're talking about mental health and yoga therapy. Bram, I was wondering if you might tell us a little bit about Breathing Deeply's approach to mental health. Of course, there's a lot of people out there who are interested in the yoga therapy field. They might be actually looking for a particular school. If I'm someone who's looking to train and I'm, interested in working in the mental health field, or I already am, and I'm looking for a supplemental skill set, why would breathing deeply, be a good choice for me?
I think the most important distinction would be the way we think about outcomes. So we're always trying to get somebody where they want to go. And sort of from the top down in our school, the most important thing is that we help someone do that as best as we can. And so we're not from like one particular lineage, one particular idea set. We have a couple main assessment models we use. And so our students are taught to kind of bob in between them instead of just having one of them, all for the benefit of the individual in front of them. The most important thing as a yoga therapist is to really see a person as a person and not a condition. And that applies to mental health as well. So often, people come to us and they're sort of pegged to someone with anxiety and depression. They might have even tried some yoga for anxiety, say, or depression, or, whatever their mental health condition is. And we see it a little differently. We really want to know a lot about this person. We want to sort of funnel that information through our multiple assessment models, and then also through clinical experience in terms of just looking back and seeing if there is any sort of situation that's been similar and have we seen these practices work for other people. And we kind of put that all together in a package and give someone the best practices for them. And maybe most importantly, after we do that, we're not computers. So we're in relationship with the person and, we give them practices in a way we think will benefit them most. And if it doesn't work, our students are trained to come up with a new set of ideas and a new system. And in that way, we find a way for a person to achieve their mental health goals.
So it sounds like you're really approaching it from an individual level. Every client is different. Sometimes when you're reading yoga literature, or you're browsing the internet and reading yoga articles, there tends to be a kind of a one size fits all approach to it, right? So this is the sequence you do for anxiety. This is the breath you do for depression. It doesn't sound like that's necessarily what I would learn at in a breathing deeply yoga therapy.
No, you'd learn several of those ideas, So of course we don't have like 800 million ideas for each individual, and we have systems and assessments. But yes, it's not like you open up Yoga Journal and you see yoga for depression. Here's your 9 poses, right? That you're going to do for depression, because everybody's different and everybody's arriving at their sort of mental states, from a different scenario in their system. So our goal is to bring balance to the system as yoga therapists, and we're going to work very hard to look at each person and their individual circumstances, for sure.
When we talk to potential yoga therapy students, they're always asking us, how does this work? What do you really do as a yoga therapist when you work with a client? So I was hoping, Brant, you could take us through quickly what your process might look like for a client who comes in with anxiety.
Well, all yoga therapy would start with an assessment. So you're going to meet the person and you're going to ask them a lot of questions. And the person's basically going to tell you their story. So you get all the information you can on them at first, and then you're going to find out how this person is suffering and what their sort of experience of it is. And why that's important for us is because we use that to assess the client in terms of what we're going to end up giving them. So one person's story, mental states, et cetera, is going to be different from the next, and they might end up with 2 different sets of practices because of that. So that's the beginning. And then once we've kind of done an assessment, we have some ideas from our training, and we teach the person some practices. And those practices sometimes unfold. So maybe it might be a few simple practices the first time we meet, a couple more the second. And after a little while in relationship together, we figure out a set of practices that's really working to bring that person to a more state of balance. And so the client would do that. And as that kind of unfolds, the yoga therapist has an opportunity to ask more questions, get more information, and maybe adjust those practices. So just a quick example, like maybe somebody's doing some physical yoga movement stuff and some breathing, and then maybe that evolves into some moving and breathing and some meditation techniques. And those start to work for the client. And then the client realizes through that process that those meditation techniques are really helpful. So maybe we give them more of that and less of the physical stuff, et cetera. It could be any balance. But through that process, working with someone, the client ends up, with a practice that's very personal to them and hopefully achieves their goals of suffering less.
So it sounds like you're really drawing from sort of a wide palette of different practices that you can give your client along this journey. So this is something that you might actually write down for them. You might write down a sequence, you'll teach them the breathing technique, you might create a video for them, but ultimately they're doing these practices on their own, right?
Yeah, eventually they have a set of practices that they can do on their own. Our goal as yoga therapists is to get them out of our care, right? So we want someone with a set of practices that really helps them and they achieve their goals and hopefully no longer need us. So that's what we're moving towards for sure.
It sounds like really empowering the client to take their health into their own hands. That's fantastic.
Yeah, absolutely. It's all about a person having agency over their own condition. Yoga therapists treat a very wide range of conditions. Yoga therapy is primarily tasked with relieving suffering, and breathing deeply, we consider suffering like really wide. So you can have existential angst on one end, and you could have a healing broken ankle on the other end. And we consider that all in the scope of practice. A yoga therapist from Breathing Deeply, they're kind of tasked with treating the person that walks in, and that person can have anything going on with them. I think the thing that might make us a little different than some programs is we kind of take the yoga all the way. So we go all the way into like sort of spiritual conundrums and looking for purpose. One of the advantages to being a yoga therapist is that you have like a wider berth. You can work with all sorts of people. At our school, our models enable you to do that. You're expected to be able to kind of think on your feet and change tactics when things aren't working. And that's all there because we want people to be effective once they're working clinically. I'm trying to teach students to think a little bit more than follow protocols. So we can work with conditions we haven't heard of. Sometimes we need clearance from doctors and all those things, but we can work with anything. For a yoga therapist to be effective and ethical, they need to be there in the spirit of service. And that requires that yoga therapist to work with people 100% in a way that has the person in front of them's goals and wants and desires and perspective on their minds. A great yoga therapist can help people find agency over their own health in ways that person would like.